Hello, my name is Wiebke Scharf-Bethfeld. I'm a professor of speech and language therapy in Bremen, Germany. My paper focuses on screening vocabulary development in bilingual toddlers, presenting a case study which examined twinning effects in the lexical development of multilingual twin toddlers aged 12 to 18 months using parental report and language environment analysis system collecting audio recordings in natural settings. In the first 2 years of language development, the size of children's productive vocabularies is related to grammatical complexity in their later speech. Children with developmental language disorder, DLD, often demonstrate vocabulary delays compared with their age peers and late language emergence in the first 2 years of life. Vocabulary acquisition is one widely recognized predictor of emerging linguistic abilities and consequently an important measure of particular interest to speech and language therapists in early language assessment of toddlers. Early screening for predictors as well as potential risk factors that may lead to DLD is of high clinical relevance. However, it is a tremendous challenge since limited vocabulary learning is likely to involve biological factors like DLD, but also environmental factors. Today, more children around the world grow up in an environment being exposed to more than one language. However, current assessment practices are still based on monolingual measures that are unsuitable for many clients on SLP caseloads. Parent report instruments are current standard in assessing developing abilities in early language, such as vocabulary production as an essential part of early assessment. A widely used parent report instrument is a MacArthur-based communicative development inventory, CDI, a checklist of early vocabulary and grammatical constructions for infants and toddlers. CDI have been demonstrated to be valid for children with language disorder, a reliable assessment tool of infants and toddlers' communicative skills, and also have been adapted to nearly 100 languages. However, their norms are based on monolingual children only. To today, there are no bilingual norms for the CDI. Bilinguals are a highly heterogeneous group. They differ in their developmental trajectory and environmental influence. Some studies report that bilingual children achieve basic milestones at the same age as monolingual children, but most studies report that bilingual children score below monolingual age norms when assessed in only one of the languages due to a distributive lexical development. That is also why bilingual children are assumed to be at a higher risk of being misdiagnosed, of demonstrating language disorder when monolingual norms of the CDI are used. Underdiagnosis often occurs based on the argument that delays or deficits in one or both languages often occur in bilingual development, as it is a case for bilingual lexical development. Overdiagnosis often occurs when monolingual norms are applied. So expressive vocabulary in bilingual children is a really difficult domain of assessment because bilingual children receive divided language exposure in diverse settings, and exposure may vary according to each bilingual environment and change over time. There are more factors that contribute to high variation from age expectations in children's vocabulary acquisition. Understanding the sources of variability in vocabulary acquisition is important. Growing evidence suggests that potential risk factors include a low level of parental education, ethnicity and culture, low socioeconomic status, which is often the case with migration background, family size and birth order, male gender, and pre or perinatal factors, such as being born preterm or with low birth weight, which is actually often the case with twins. All these factors affect child language acquisition and lead to an even greater variability in bilingual language development, especially having an impact on lexical development. More, in clinical practice, Many children do not present with a single of these confounding factors, but with a combination, like being male, bilingual, twin. In sum, it poses a question on best practices when assessing lexical development in bilingual toddlers, that is, what data can be considered valid when screening bilingual children. There is substantial evidence that the amount of speech children hear is related to the rate of language development, supporting the view that language development is paced by children's access to input. The range of variability in how much speech young children hear is enormous. Children whose daily language exposure is divided between two languages are likely to hear less of each language than children whose daily language exposure is only a single language. Similar, twins who daily share environment experience that language exposure is divided between them as well. This factor of shared environmental influence is often referred to as twinning effect. Coming from the basic assumption that language development is paced by input and that bilingually developing children's single language input is reduced compared to monolingual children, and that twins' input is reduced compared to singletons, it yields the objective of the present study that an additional digital technology may be useful to assess the children's relative amount of language exposure. Well, exposure is more than word input. Next to the amount of speech, it is the frequency with which adults direct their speech to a child that elicits talk and the number of conversational turns in adult-child interaction. It is a better predictor of children's later scores on an omnibus measure of language skills than the amount of talk produced within the child's range of hearing. Evidence also suggests that children's output contributes indirectly to their language growth via the input it elicits. Some of the types of adult utterances that support child language growth are utterances that respond to or pick up on prior child utterances in some way, including expansions and recasts of prior child utterances. So indirect feedback supports language growth. Therefore, caregivers' child direct speech and conversational turns with children seem to be a positive predictor of language growth. The finding that the count of conversational turns is a better predictor of language growth reflects that this measure captures an indicator of adult talk that engages the child's attention and benefits language growth than does the measure of how many words a child produces. And finally, with reference to bilingual children, conversational turns seem to be less biased than the lexicon of a single language. So the participants in the current study are healthy, bilingual, Spanish-German, male twins, contemporaneously electronically recorded between the age of 12 and 18 months at home in the natural language environment using LENA. I will go into this in a moment. Measures of children's language development were collected over time using questionnaires for caregiver reports, such as the German adaptation of the MacArthur Communicative Developmental Inventory, CDI, which is called ELFRA. The bilingual patient's profile, including multilingually, culturally sensitive case history form. And when the children turned 3 years, they underwent a comprehensive language developmental assessment, which proved that their language development trajectory was within average and therefore healthy. LENA was used to facilitate the repeated collection and analysis of audio recordings in children's natural environment at home. The device fits into a chest pocket on a child's t-shirt and records any auditory signal in its proximity. Collect data encompassed audio environment, adult word count, child vocalizations, and conversational turns. From the very beginning, their mother describes twin number 1 to have a larger vocabulary than twin number 2. The CDI was adapted to take into account both languages, German and Spanish. I will present data on words only, as this was a main focus. You can see that without taking into account Spanish words, the linguistic abilities of twin 1 wouldn't have been captured. It is noteworthy that twin 1 is reported to produce more words than twin 2. Twin 1 produces some words in Spanish only, whereas twin 2 demonstrates more equivalence. Among the Spanish-only words were those that are easier to pronounce compared to their German equivalent and vice versa. All findings were in normal range. The composition of the conceptual vocabulary differs in both respects, comprehension and production. Findings confirm the caregiver's notion that twin 2 would be a more balanced bilingual. Taking into account the caregiver's information, the mother stated that she experiences herself turning to twin 1 more often due to longer periods of crying. Also, she experiences twin 2 to be less expressive. It is noteworthy that conversational turns do not necessarily reflect vocalizations between adults and children. Further analysis revealed turn-taking between twins as well. Findings of the turn-taking analysis revealed that twin 2 overall received more turn-taking experience, a plus of 288, that is 7% more compared to twin 1. In all, LENA allocates both twins below average, but we need to bear in mind that the percentile norms are based on American monolingual English and on singleton children. This screenshot shows estimates at the time when the boys were between 12 and 18 months old. The findings confirm twinning effects in form of a reduced verbal input. The results demonstrate high internal consistency with the caregiver's estimate. Reliable information needs to be guided, though, as word production seems to be a less reliable measure in parental report if there may be perceived differences concerning with what is being counted as a word and what is not. Despite the nature of a case study, it can be assumed that LENA is limited to quantitative data, but definitely helps to allocate, interpret qualitative data. And moreover, it may verify qualitative information very early in childhood and therefore assist to derive diagnosis much earlier. Caregivers' estimates seem to provide reliable information, but this is, as always, depending on the method used. Bilingual versions of the CDI are definitely needed. Application of adapted monolingual versions would be invalid, especially when it comes to word production. Results regarding the use of LENA are promising for cross-linguistic applications, as it is definitely, or it seems to be, a useful screening measure, especially with regard to early interventions and to aid decision-making on whether a thorough language assessment should be undertaken. LENA provides additional valuable information on communication that are especially helpful to interpret information on bilingual language development, as it takes into account all communication despite the use of a specific single language. So results are promising for cross-linguistic applications as a useful non-biased screening measure in clinically early prevention contexts. However, quantitative measures should only accompany qualitative measures with regard to clinical objectives. When it comes to bilingualism, a combination of measures provides much better results. LENA could help to be a useful tool in clinical context to aid in determining whether further assessment and intervention should be conducted. Hence, combining parent reports taking into account all languages and LENA should provide the best criterion validity. So thank you very much for your attention. And if you like to stay in touch or get in touch, don't hesitate. I'm looking forward to hearing from you. And finally, here's the literature to my talk.